All right. Well, good afternoon, everyone. I hope your day is going well. We are super excited to have this wonderful discussion with you today. Today, we will be discussing higher learning, supporting college student health. I want to first introduce our panel. We are Dr. Kelechi Fluitt. I am the Outreach Director at the Howard University Counseling Service. And on our panel, we have, and I will allow them to introduce themselves at this time, starting with Jason. Okay. So we have on our panel, can we hear each other? Yes. Okay. So I'll go ahead and introduce everyone. Okay. So we have on our panel, Jason Williams. We have Nyla Williams. We have Tida Tambedou, and please correct me if I mispronounce it. We have Tajah Pinkard, and last but not least, myself, Dr. Kelechi Fluitt. So today we're going to be discussing, like we discussed earlier, higher learning, supporting college student health. So the first thing we're going to talk about, or the first question I want to pose to the panelists is, given that the Black diaspora is multifaceted and culturally diverse, perceptions of racial ethnic campus climate at colleges vary amongst Black students. Is there a common thread or shared experience that you've encountered that's a barrier to mental wellness on college campuses? So once again, is there a common thread or shared experience that you've encountered that is a barrier to mental wellness on campus? What do you think?
I think a common barrier that we tend to see is, when we the collegiate experience, people are coming from their own communities, with their own values, with their own understanding of how things should be. And when you come into a shared space like college, then you have to acclimatize to what's going on in that environment. And there can often be a clash between those two. So particularly when we're thinking about, young adults who are developing at a rapid rate physically, mentally, and emotionally, the barrier tends to be how do I ground myself in what's true for me, while keeping in mind that there is a certain level of connection I have with my community. So I want to be liked and respected and heard, but I also need to protect myself and be true to who I am. And some of those things can often be at odds.
That's a good point, Jason. Anyone other thoughts around it? What do you all think?
So for me personally, I go to a predominantly white institution, So I feel like there's already a struggle with talking about mental health, kind of getting across the stigma of mental health when it comes to just young people in general. So being a Black young woman is, I feel like, 2 times harder to kind of not only share my experience with mental health, but just talk about it with peers. I personally do utilize my campus's mental health resources, and I try to direct my friends, especially in the Black community, to it, because there is no shame in needing help or asking for help. But it's just unfortunate that, especially in the climate that we're in today, it's just not priority to kind of put your mental wellness first.
Yeah. So what do you all think? Oh, you wanted to add something? Please.
I was just going to say, I think being at an HBCU is kind of a unique barrier because some of us come from similar backgrounds. And I think what gets in the way is just the pressure, like the strong Black womanhood syndrome or John Henryism, to feel like you have to be this strong person, you have to accomplish so many different things that you don't share the struggles that you're going through. And so that kind of prevents people from getting the help that they need because they want to seem like they're perfect, they're excelling, especially like being at Spelman where we have like this reputation to uphold. Is sometimes if you seem weak, it makes you feel like you're not living up to what people expect of us.
I agree with Taya. I feel I also attend Spelman College, so I see a lot of the same things. And I think some of us, we still carry some of the misperceptions about mental health and therapy that are prevalent in the Black community. And like Taya said, going to seek out mental health services, that doesn't make you weak or make any assumptions about yourself. I mean, you can just go to therapy if you're having a bad day or struggling with assignments. It doesn't mean that you have like a severe experience. So I think it's important to just normalize the experience of going to mental health services in the Black community.
And I agree with that, right? As a person that works at a university counseling service at Howard, just really being clear that, to your point, you can have a gamut of experience, right? You don't need to be on one end or the other to seek services. You can just seek services because of where you're feeling. So sometimes the assumption is that you have to be on this end or the other end, but rather just really getting the support that you need in the meantime. So I guess as we transition that question, what types of mental health concerns and or challenges do college students face in 2020? And how do students manage those challenges? So it's a two-part question. What do you think are the types of mental health concerns and or challenges that college students face in 2020? And how do students manage those challenges?
So I'd say for me, there's two. The first one definitely is being with COVID. So being in a pandemic, we actually did transition to online school, most of us in the spring when COVID kind of started really spreading. We didn't know what was going to happen. And then a lot of us found out that either we weren't allowed to come back in the fall, or it was you can come back, but it's kind of at your own risk. So I just feel like that having to deal with that on top of also still being a student, trying to excel and having to balance like social life and your extracurriculars in school has been especially hard, because this is not something really any of us had to go through before. So we're all kind of going with the flow, trying to figure it out while still trying to, like maintain our grades and be a college student. And I'd say the other part or challenge that I say that we're facing in 2020 is kind of just the climate with politics. We're in a presidential election right now. There was a lot going on with the racial tensions and the pandemic. So kind of a mix of going back to school. I feel like personally, one thing that I kind of hear a lot about is like, you're so lucky that all you have to do is go to school. You're not really having to be out in the real world, pay bills and all of that other stuff. But personally, I feel like going to school is a full-time job. And some people do have to still kind of like pay bills, get themselves through college. So that can be very debilitating on someone's mental health. And I just kind of try to really advocate for like, yes, we are in college, but it's not all fun and games. We are there for a purpose. So we have to balance, going to school and also taking care of ourselves and mental well-being.
Challenges in 2020. So what are some of the challenges? She talked about COVID-19, right? So now having to go from brick and mortar to virtual, right? And all of the mental health concerns that may come up for students in that need. What do you all think? Are there any other challenges that students are facing in terms of mental health in 2020?
I think there's something to be said about just grieving the loss of your expectations. That, if you are a college student in this day and age, you've obviously lived long enough to get used to the normative process of registration and, cafeteria life and all the things that you really signed up for. And those things all were brought to a grinding halt. You also are probably thinking about what is life going to look like post-graduation with internships. So you're holding all of those real things about your present and your future. I would suggest, as always, that you just acknowledge it, that you hold that it's a difficult time, and that you set aside time and space for you to be okay with the uncertainty that this is all presenting. That can come in terms of, therapy, daily affirmations, trying to hang on to the parts of your life that you can continue to, whether that's working out or connecting with friends. There are ways that you can still be grounded in the things that have brought you joy and pleasure, and not feeling bad about that. There's something to be said about, appreciating what you can do in difficult times and being okay with that.
I would also add, like, so with COVID-19, especially being a senior in college, it's a really interesting experience because we were unfortunately not able to come back to campus this semester. And most likely, just because the cases in Georgia are still high, a lot of us feel like, there's a chance we won't be able to go back. So just thinking about how does that look for us? And a lot of people are actually finishing this semester, including myself, and they said more than ever, which I think has a lot to do with just virtual school is taxing, and having to finish your senior year online is not necessarily like the most exciting thing in the world. And, having the transition so abruptly from, saying goodbye just for spring break, but like that was the last time I ever saw my friends, and not knowing when we'll get to see them again. And I think even like before COVID-19 happened, one of the struggles for college students is just the fact of where we are in the world today. And so a lot of people saying, bachelor's degree is just kind of like the new high school diploma, but that you have to continue to like get a master's or get a PhD. So it's a pressure to, I just finished this one degree, but I still have to do more to be recognized as someone, I guess, of value in the larger field.
Completely agree with everything that everyone has contributed. I think that, a lot of college students today were also just like worried and stressed, especially about post-grad experiences. I know that's what Jason Williams had mentioned. And I think that, like for myself, I'm applying to graduate school. And so this semester I would have, tried to go to some conferences and maybe connect with some of the PIs that I potentially would like to work with next year in graduate school. And I can't do that. I can't connect with them in the same way that I would have liked to. So I think I'm constantly concerned about that and whether or not that will impact the application in any way. So I think for me, I've just been trying to reach out to supportive faculty members and mentors and the counseling center to sort of alleviate some of the stress and anxiety that I've been feeling during this time of COVID.
We think about that. We think about, to your point, what is happening, how we're coping, how we're thinking about everything that's happening in our lives right now. And we all can agree we would never imagine that this would be our reality, right? This little box, right, that we find ourselves in every day, whether we're working or going to school. Have you ever dealt with feelings of imposter syndrome? If so, what has helped you overcome those feelings? Have you ever dealt with that? Is that something that's ever come up for you?
I would say yes, definitely. That happens a lot for me, but I would say one thing that really helps is my support system. I had a research internship at University of Michigan. I just felt like, oh my gosh, and I didn't realize like what University of Michigan like all it stood for, just because like I'm a first-gen student, so my scope of things was a little smaller, and so I was like, probably not that many people applied, I just got in by luck. And my friends were really just like, no, like that's not the case, and just saying like, you have done all these great things, you deserve to be here. So I think really just making sure you have a nice supportive village around you that pours into you and recognizes what you do is meaningful is very helpful.
So I personally have dealt with imposter syndrome probably more than I've actually realized. I deal with anxiety, so I feel like they definitely intertwine, and I undermine my achievements, anything I get, different things like that. So what helps me is kind of taking a step back and looking at all that I've accomplished. And even if I haven't accomplished all of my goals and everything, kind of figuring out how I can get there. And I would definitely say that imposter syndrome, it will come and go. I probably experienced it more, I'd say, in my upper levels of college, because I kind of seen like everyone is amazing in their own way. Like at first, I'm kind of like, okay, yes, I have my own attributes that can stand out, but so does the next person. So what makes me different from the rest? And kind of reminding myself that I am amazing, like I am intelligent, just different affirmations and going from there. And I definitely agree that like having a great support system can take you a long way, whether that's a mentor, a therapist, or if you just personally have to be your own cheerleader. It's definitely essential.
I agree. I've also experienced a lot of imposter syndrome and self-doubt throughout my college experience, especially when like a presentation comes up or internship. As Taya was suggesting, last summer I was at Children's National Medical Center and I was the only Black student in my lab. So I felt very insecure. I just like assumed that, you know, the other members of my lab were doubting me in some way. So I really just had to build myself up throughout the summer. I tried to remind myself that you've accomplished other things in the past. You've gone through tough challenges and things in the past, and you got through them strong and you came out better. So I try to, you know, like affirm myself and just give myself that encouragement. And of course, like reaching out to supportive mentors and like family members that can build me up when those challenges kind of arise.
I definitely want to highlight the points, right? So the points of the importance of a strong village, I think that's essential, and people who are rooting you on, and the importance of you rooting yourself on and to encourage yourself. And Nyla said something that I thought was really great, right? She talked about this notion of affirmations, and she gave her examples. And I want to add to that by saying, I belong. It feels like that's some of the underlying theme, right? When we enter into spaces that we feel like potentially I kind of got here by luck or by coin toss or something like that, reminding yourself in affirmation, like I belong here. You know what I mean? This is my seat and I am sitting in my seat, and really just taking that in. So really want to congratulate you all on the experiences that you had so far and wishing you a lot more success. But yes, with imposter syndrome, we all experience it at different points. Whether it's in school or whether it's now in work, you know, this notion of like, you know, they're going to find me out or, you know, whatever the case may be, but reminding ourselves we belong. This is our seat and I'm going to sit in my seat. So Black students report many faculty are not trained or comfortable with dealing with classroom micro or macro microaggressions or macroaggressions. Let me say that. What responsibility does the college have to do, or what responsibility do you think your college community has to provide mandatory culturally competent training to staff and faculty? And what impact do you think that macro and microaggressions have on Black students when these biases go unchecked? So I'll say that again. What responsibility do you think that your college or your university community has to provide mandatory culturally competent training to staff and faculty? And what impact do you think these macro or microaggressions have on Black students when these biases go unchecked? What do you think?
So again, like from the perspective of going to a PWI, I think it's the university's full responsibility to provide training on this culturally diverse settings, cultures, everything, especially because college is a ginormous melting pot. So personally, like my school, they provide, well, not provide, they actually require these trainings to do before you come to campus that are centered around like sexual abuse and alcohol. And if you don't do them, they're emailing you every day, like you need to finish this, you need to finish this. So I personally feel like they should do the same for culturally diverse training for both students and faculty. I personally am usually one of the only Black students in my class, if not the only. And just looking back on my college experience, I definitely have experienced a lot of microaggressions that I just didn't even realize they were, or I did, and I didn't want to speak up because I'm like, well, my teacher controls my grade. If I speak up, then they're going to not, let's say, like round me up if I'm on the board, or they're going to take it out on me, because I have dealt with a teacher publicly in class, like attacked me for I really don't know what reason. But I just think that, again, it is the university's responsibility, like I stated before. And the impact I feel like that it has on Black students when these biases go unchecked is it definitely can impact both their mental health and just their outlook on school, I feel like, because they feel like, well, I'm paying to go here. I matter just as much as the next person, but I'm not being reassured that my voice matters, that what my like opinions and beliefs that I have matter. So I just feel like it just has a negative impact overall, and it's something that should be addressed in any aspect of like college life.
agree that it should be absolutely mandatory for colleges to provide culturally relevant training to professors and faculty members. As a college student, I expect my professors to be encouraging and to support my goals and endeavors. And so I think that Black students that experience, microaggressions and macroaggressions at the hand of their professors, they could potentially experience mental health concerns. They may experience self-doubt. They may lessen their goals to something that's more seemingly realistic and just maybe stop challenging themselves. So I think it's very important that professors and faculty members are trained, because you never know how their words can impact students.
I would say also, like being at an HBCU, it's not so as much of an issue of like microaggressions for Black students, but one of the bigger things I would say for us is kind of with the LGBTQ plus community. And like as an RA, we had to go through like a lot of trainings of how to be sensitive and understanding of your residents who are in that community. So I think, if us as student leaders are required to, then definitely faculty and professors should be as well.
Highlighting a great point, right? And the point is, we have expectations as students. We have expectations as, quote, paying customers. Even if you're on scholarship, someone is paying for you to go there, right? And we have mandatory trainings that we are expected to take to make sure that we are in line with the university's value system, right? And being culturally competent, it is essential that the people that teach us, the people that are around us, the people that are in our campus community are also sensitive to those things that are specific to us. And so Taj brought in an additional dynamic, which are people who identify differently, right? It's important that everyone feels like they are a part of an inclusive space and that they are not excluded in any way because of their difference. And so really just being intentional about that. So I really appreciate that. I think you all gave a valid point. We have to take trainings. They should have to take trainings too. Mm-hmm. Would you be able to speak more to the unique challenges that Black students face during COVID-19, coupled with the protest centered around Black Lives Matter movement? How may virtual learning present its own hidden prejudices to educational equality? So once again, would you be able to speak more to the unique challenges that Black students face during COVID-19, coupled or additional or added to with the protests that's been going on around the Black Lives Matter movement? How may virtual learning present its own hidden prejudices in educational equality?
So immediately when I kind of read the first part of that question, the first thing that came to my mind about the unique challenges that Black students are facing is Black trauma. So Black trauma on social networks, Black trauma on the news. I feel like everywhere I turned to, it was something that it could be positive by spreading awareness, but it was negative in the sense of their graphic images being shown, graphic videos, stories, just different things where it's just like, oh my gosh, like my people are suffering. And even if it's not directly impacting me, it is. So I feel that that was a major thing that Black students were kind of facing during COVID. A lot of people were going out and protesting, kind of figuring out where they can use their voice to help, whether it's through raising donations, awareness, different things like that. And I feel like there also was kind of a pressure to do something. And for me personally, like I did have to take a step back from social media when everything was going on, because it was just so much. It was emotionally, physically draining, and it just hurt to see everything. So I would use my platform through advocacy, kind of awareness, but also stressing the importance of taking care of ourselves, our mental health, especially as everyone's kind of on edge already about going back to school as a student. So I also feel that for the second part of the question, the hidden prejudices that virtual learning presents is one, kind of the fact that Black students usually have significantly less resources than compared to their other counterparts. So whether that be like access to a network in order to complete their schoolwork, a computer even, or like different databases such as like Microsoft Word, Google Docs, different things like that, where they need in order to succeed academically. I feel like it's upsetting that there wasn't more steps taken to ensure that people were able to virtually learn, because we kind of were forced into it. We didn't have a choice. So it's like, if you are, let's say, in a situation where you can't afford to have the different things that are usually provided to you at school, then it's kind of like, well, what do I do now?
Another unique challenge that Black students are facing during COVID is just having difficulty present in your classes and the student organizations that you're a part of, because you're worried about the protests and the Black Lives Matter and everything else that's kind of going on in addition to COVID. And so it's hard to focus on assignments because they seem like, this assignment is so minimal in comparison to everything that is going on in the world, and I want to focus on that. I don't necessarily want to focus on a paper. But, we have to manage all of those things. And like Nyla said, I think separating yourself from social media is a great idea, because there's just a constant stream of information about everything that's going on. It doesn't stop. So you have to, take it upon yourself to just take a break. And also, you might have to separate yourself from conversations. If some of your friends and family members are frequently discussing everything that's going on for your mental health, you might have to say, okay, today I really can't, discuss this matter with you because it's just affecting my mental health. So I think it's important to be honest about that too, if you come across that challenge.
And one thing I would add, like with the COVID-19 piece, is with HBCU students, a lot of them just having the difficulty of, is my school going to be able to withstand this? That was something I thought about a lot during the beginning of this, because my brother's school made the choice to allow students to come back this year. And I wonder, part of my thinking was a lot of that probably has to do with funding, because if we think about it, a lot of HBCUs already have issues with funding. So what is it like to close our doors to students for an entire year? Would we be able to stay afloat? And so just a piece of that, because we didn't get as much money as public PWIs did, is also something frustrating, I would say.
You are right. You're right on the money, right? Being able to do your own self-check-in, to be able to say, I'm at my capacity. I can't take it anymore. I can't do anymore. And I understand if you feel the need to talk about it, and I may have to take myself out of this group chat. I may have to excuse myself from this conversation. I may need to log out of the computer. So really just being mindful that you're in a time where you're learning virtually in the midst of a pandemic and protests and elections and so much happening in a span of 8 months. And it can feel, and it is and can be, very overwhelming. So really just checking in with yourself to see what is the best for my mental health, right? What is the best for me in this moment? And so I'm grateful that you all are finding ways to take care of yourself during this time. So I know we talked about this a little bit earlier, campus resources, but I want to go back to that. What are some on-campus resources that you have found helpful as a college student? Have you or someone you know utilized the University Counseling Service or Center, depending on what it's called in your university? What are your thoughts about that? What are campus resources that are helpful? And do you know of people, or if you want to share, do you connect with the university on your campus?
So for my school personally, we do have a University Counseling Center. We also do have a program called Thrive, which basically spreads the awareness of mental wellness around our campus. And there's Thrive leaders who are students, and they're like advocates for mental health, different resources. Like they hold events that have things that range from self-care activities to how to manage stress, anxiety with tests and everything like that. So that's kind of what I try to look for when I can feel myself kind of like getting overwhelmed, or when I'm looking for like some help. I also think mentorship is another big thing for me personally. So I've had the opportunity to have mentors and also be a mentor. So that is a major resource that I've used out of my 4 years at my university, kind of just being able to think of like what I need help with and what that person needs help with, and we kind of bounce ideas off of each other, whether that be professionally or personally. And as for our campus counseling center, I've utilized it actually for the past 3 years. So 3 out of my 4 years, I did have a therapist who I was seeing regularly, and I continue to see them even when I was feeling better and kind of wasn't in like a depressive episode or different, or like having high anxiety. I still utilize them kind of as a way to help me set myself up for success. So whether it be like going only once a month or every other week, I kind of just go with how life is taking me. And I honestly think it's changed my life. So I definitely advocate for people out there to check out their campus's mental health resources. And if you're scared, you can always bring a friend. I also have like a best friend. She's someone who kind of opposed to therapy. And I remember I actually went with her to her first session just to kind of see like, hey, this is not here to hurt me. This is here to help.
Also utilize the on-campus counseling services at Spelman. I heavily rely on my mentors, and I also am a part of the Spelman Psychology Club. And I think that's just a safe space where we can discuss mental health along with planning events on self-care and other tips to just motivate students. So I think being a part of that group motivates me as well. Like while we're planning events, we're also still there's still a sisterhood there. We're still able to have conversations. So I think that's been a great resource for me.
Similar to Tida, I'm also in psychology club. So that's a great source to be able to talk about what I'm feeling. And also I think at Spelman and a lot of our classes, we kind of sometimes debrief on what's going on. So having that community has been nice, as well as utilizing the counseling services throughout. And this year has been especially helpful with Dr. Busby, actually, who is my mentor through Black Mental Wellness. And so just really being thankful for Spelman for sending that opportunity to us, and to have been blessed to have a mentor, especially during this time, has been really helpful.
Of community, right? This theme of mentorship, this theme of seeking support when you need it, right? It's going to be really essential as we have a lot of college students that are maybe watching today or will watch this later at a different time, really just connecting with the supports that you needed. So each of you brought in a different support. Definitely, of course, as someone who works at a university counseling service, I will encourage you to go to your university counseling service and get the support that you need, and or find a mentor, and or build community and find ways. I love that. I don't know if Thrive is an acronym or if it's just a name, but either way, I love that, right? Because everyone wants to be able to have the opportunity to do that, which is to thrive. And so even maybe you all thinking about what ways, when life returns to whatever we feel is the new normal, can I now pass on the information of the importance of mental health, right? What ways do I find myself being part of that conversation? And so really thinking about that. When we think about campuses and campus structures, right? Each of you have mentioned, we have two people on this panel that are from Spelman, and then we have one person who's from a predominantly white institution, right? And some of you have already talked about having experiences at predominantly white spaces. So whether it's for internships or a job or whatever the case may be. So on predominantly white campuses, how can Black students create a sense of belonging and community? Are Black fraternities and sororities enough to foster connections often necessary for future success? So I'll ask that again. On predominantly white campuses, and even if you don't attend there, just being thoughtful about that, how can Black students create a sense of belonging and community? Are Black fraternities and sororities enough to foster connections often necessary for future successes? What say you, distinguished panel?
So personally, like going to a PWI, the first thing that came into my mind with creating a sense of belonging community in the Black community is kind of going for a multicultural org. So whether it be like Black Student Union, we have an organization of Latin American students, different orgs like that, an NCNW can definitely allow you to congregate and brainstorm with people who look like you. And that's kind of what I did as coming in as a freshman. And then as I like progressed in my years at school, I stayed heavily involved in organizations like that, but also just branching out of my comfort zone. So not only just interacting with Black students on my campus, but also those of other races. And I definitely have seen myself like doing that more in classes because that's when I tend to be the minority the most. But just being able to look at the bigger picture and not just always kind of worry about if they look like me or not, and if they can have shared experiences as I have, because you're going to learn regardless. So I feel like that is super important, just kind of getting involved in where you can and going from there. As for Black fraternities and sororities, at my school, I do go to a small PWI, so we have 4 out of the 9, Divine 9, and I am a member of Delta Sigma Theta Sorority Incorporated. And being in that has allowed me to kind of branch out with the other orgs in Divine 9, but also orgs that are of like white fraternities and sororities. We've held events together, like did different things where we're mingling, mixing, and kind of mixing our programs so it doesn't look like there's a divide on campus. I feel like that was also super important because yes, we have our own council and they have their own council, but if we don't come together, what is that kind of looking like to the rest of the campus community?
I would also highlight the importance of like Black student unions. I have a cousin who goes to University of South Carolina, and she's heavily involved in their Black student union, and they have a lot of events, which is very helpful just to have a sense of community. And then they also have like a group chat. So I think those are great ways to, although maybe in your day-to-day classes, you're not surrounded by Black faces, but you can go to this event after class and feel safe. And then also when the protests were going on, they had that outlet to go on and have a Zoom call and discuss with each other. So those I think are critical. And I think Black fraternities and sororities are a great use of community as well within white spaces. But of course, there can always be more, as only so many people can be accepted into those. So I think just still fostering relationships outside of that is important as well.
I think the Black Student Union and also the Black sororities and fraternities can be very helpful in terms of building that community and sisterhood and brotherhood that is absolutely essential. I think it would also be really helpful to have a Black club or organization that's centered around mental health. So that way that can be a space for students to sort of describe their experiences and, I don't know, just build an additional form of community centered around wellness.
Yeah, as a proud brother of one of what I think one of the greatest fraternal organizations ever created, I think that we play a critical role. But as you know, the other panelists highlighted, because there's a inside and an outside, that you know, it's more important for the community in general to foster connection and for us to really recognize our needs and how we can connect with folks.
So once community, right? And so we have a couple of minutes left. If you have questions for the panel, we're going to go straight into Q&A next. So please submit your questions for Q&A. But when we're thinking about this subtopic or this topic for our particular panel, which is on higher learning, supporting college student health, a lot of our discussion has been about the importance of building community, the importance of seeking services at the University Counseling Service, the importance of culturally competent training, not only for students, but particularly for faculty and staff and anyone working in the university settings. The importance, I think the added piece would be the importance of seeing where there's a need and finding ways to meet that need. right? And so a lot of you have discussed your own personal experience with mental health, your own family experiences with mental health, as well as your friendships and being able to support people in their mental health. I think while we wait for some questions, I want to just kind of toss out to you all just to kind of see, how have you been coping? What has helped you through this pandemic? What are some ways that you relieve stress? Because it could be helpful to add to other people's toolboxes as they think of ways to cope. So how have you been coping with virtual learning, with COVID, with the political unrest? What are some things that you do to rejuvenate yourself? What are some things that you do to get back your equilibrium? Anyway.
So I guess I need my top three because I am a psychology major, so mental health is like my life. And I say the number one is my therapist. So I actually was continuing services through our counseling center all throughout quarantine and up until this point. And like I kind of mentioned before, having that extra support there to kind of help me map, plan, and also work on my mental wellness was everything to me. Number two is staying organized. So that's what's really helped me with this online learning transition, coming back to everything that was different at my university, just staying organized, whether it be through my Google Calendar, my personal planner, and just also scheduling some me time. So that's probably my third point, always making sure that you are okay, because you can't be service to anyone else if your cup is half full. And I always try to remind myself of that all the time. Like, even if you're just taking like a 5-minute stretch break from between work or doing homework, if you're going for a walk, just getting some fresh air and kind of resetting your inner clock is, I feel like, one of the best things that you can do. So personally, also developing a morning routine is something that's helped me a lot. So as soon as I wake up in the morning, I kind of get up, make my bed, and I stretch and meditate. And it's only for about 15 to 20 minutes, but that kind of sets the pace for my day and also the rest of my week. So I'd recommend kind of looking for some things that you can do, even if you don't want to meditate. There's yoga you can do. Like, everything is on YouTube or in the internet at this point, which is nice. So if you're kind of looking for some ideas, I'd just search the web and see what you can find.
I don't think, for me, I don't think I can emphasize the importance of self-grace, whether that's in class, whether that's at home, whether that's working, of just allowing myself the understanding that it doesn't have to be perfect, that it doesn't have to be, to this, unreachable standard, that I can function and move forward in a way that is purposeful with integrity, but doesn't have to kind of, formulate to this outside understanding. For me, that's been, walking more, to Mrs. Williams' point, checking in with people is important as well, because I think that fosters the community that we've been talking about. But it's also just so important for me to just understand that the paper will get done, the work will get done, and that I want to be here afterwards. So I have to invest in that as well.
I definitely agree with everything that Mr. Williams just said, because I'm a huge advocate for rest. So and I get overwhelmed really easily. So just kind of knowing that to prevent from like me feeling burnt out, and then it becomes a bigger issue, I just say, okay, let me take a step back and just allow myself to rest and rejuvenate. And then I can give something my entire thoughts. So if I know, okay, it's after 11 p.m., I'm kind of stressed, I'm probably not even going to be able to focus on this paper as well as I need to. I can put it off for tomorrow, and not feeling guilty about that, just because of the fact that, we are online for most of the day, and there's a lot of assignments and there's a lot going on, and it's okay to just take a step back and not feel bad about that. And with that, something that's helped me is creating a schedule. That's what I started doing when we did the transition to online. So like, I say I'm gonna wake up at this time, and then I make like a schedule, like I'm gonna work for an hour, take a 10-minute break, and I do that for the entire day. And that's really just helped me I would say limit distractions as I do work, so I'm not on my phone because I know I have a break coming up. And then it just helps me to know, like, this is what, not only making a to-do list, but saying, like, this is how I'm going to achieve that to-do list. Because a lot of times I'll make a to-do list and then I just sit in bed and nothing happens. So holding myself accountable definitely helps.
I just wanted to add that a tip that I found that was really helpful is I downloaded the Calm app, and it's been really great because I've had some difficulty sleeping, and they have all sorts of like sleep meditation, sleep stories, sleep sounds. So that's just helped me relax, because I find that, especially with finals coming up, my mind is just racing with all the things that I have to do. So I think just having something to tune those thoughts out at night has been great. And I think I also have been doing checklists. And so it's just really satisfying for me being able to check things off, like, oh, I did that. And that makes me feel like really good in that moment. So those are sort of the things that I've been doing.
I think this was helpful, even for me, just reminding some things that you all do connects with what I do. I have a couple of questions in the chat. As a parent of a college student, can you advise what are some ways we can recognize when our children are in crisis, or how do we best support, provide help from afar? So I think just as a college mental health professional, I would suggest, I think that one of the things that you would notice is any changes that you see in your child that is not aligned with who they have been and who they are, is a way to kind of give you a little bit of insight, like, okay, something may be happening. And really just encouraging them to have open discussion with you, but also to seek services. So it may also come in the form of, hey, there's some options or some things on your campus that may benefit you. It looks like your campus may be having a wellness retreat or a wellness conversation or post-election support space. Why don't you think about doing that? So often good suggestions, so not judgments, but hey, just some encouragement to attach may also be helpful. Any thoughts people have, and we'll do it like a quick fire, about a parent of a college student, how to advise if their child is in crisis and how to provide support. What are your thoughts?
One thing.
I'm sorry. You can go ahead, then I'll go after you.
Okay, thank you. One thing I would say is just knowing the critical periods of stress during the semester. So like maybe asking them ahead of time, when are your midterms? When are your finals week? And then providing like a support package to them. So maybe if you want to put their favorite snacks. And one thing that they do at Spelman is like notes of encouragement on the wall people can take for like putting that, I think, in a box and mailing it would be helpful, because like it's coming from you as a mom and you know the things that they like to hear. So I think that could really just, even if they are stressed, help brighten up their day.
Yeah, kind of going off what Taj said, I think a little goes a long way when you kind of notice that your child may not be acting like themselves. So my mom, she personally, now she's learning more about kind of like my struggle with mental health, and she'll do things like, she'll just text me, say like, hi, how are you? Do you need anything? Are you okay? And stuff like that means a lot to me. And I think the other thing is just listening. So if you kind of feel helpless, you feel like you don't know what to do because you don't really know much on the topic, just listen to your child. They may feel like that no one is listening to them or no one understands them. So just lending a listening ear can go a long way. And don't feel obligated to kind of like act like you're a therapist and give them feedback back, even if you're just there to provide support. That is better than not being there at all.
The next one I'm going to merge a little bit. How do you feel Black clinicians in college counseling can best support students? And then another part to that question could be, should there be more focus on mental health for men? So should there be more focus on mental health for men? And how do you feel like Black clinicians in college counseling can best support students?
I would say to the second part, absolutely. As men, particularly as men of color, we have to be mindful of our intersectionality around our ability to show up in a space that is supportive of women, and particularly women of color, checking our own privilege. And I think, as a clinician of color who wants to be in the collegiate space, I think it's really important to want to challenge some of the issues that students feel, whether that's not being supported by staff, not being seen and heard by staff, and using your authority and power in that space to allow this experience to be productive for students of color, because it's their space as well, and we often don't feel that we are supported.
Black clinicians and Black mental health professionals in college settings can to connect with students. I think it's important to tap into all the things that they're involved in. So whether that be social organizations, just popping in and saying, hey, we're here, we can help, whenever you need. I think just making sure that you're visible to students so that way they know exactly where you are when they need them, whether that be through social media, and just finding ways to frequently connect with them so that way they know that you are there and available and ready to help.
And as the director of outreach at Howard University, as a Black clinician myself, I think one of the other things is really to put together mental health events that speak to where the students are. So some of the things that I've been able to create during this pandemic time is really just having a space for them to talk about the feelings that they've been dealing with in the pandemic. We've had events around grief and loss because that's a major part of the pandemic, and a lot of students are going through that. We've had panel discussions with other Black clinicians all over the world that's kind of talked about COVID and depression and anxiety. So even as you try to find your ways to support your students, whether your students have come back to campus and are in smaller form on brick and mortar or virtual, think about yourself, think about them and where they are, because we're all in the pandemic, and try to find outreach events that speak to that. There's another question: working at a PWI without Black counselors, how can we help students seek/trust services they need, or suggestions on how to help the students? So this is someone from a PWI who doesn't have any Black clinicians. How do they gain the trust of their students to support them during this difficult time?
I think you have to ask yourself. No, go ahead.
No, you can go. You started. It's okay.
I think asking yourself how you can connect them with services that may be outside of their campus is an important way. PWI can sometimes feel isolating. So if there are services that are outside of campus that can be helpful of that, then I think that's a great way to start. And also just listening to what they need. Maybe they do need to see someone like them in that helpful space, or maybe that there's a call for you to, adjust the cultural competency of the services that you're providing.
I completely agree. I think so. My therapist is actually white, and we don't have any Black counselors at my school. And I was kind of hesitant at first because I didn't know if she was going to be able to relate or if she would be able to provide care. And I would say kind of be open to being, I guess, like trusting that you are a clinician, you know what you're doing, and just being there to support and listen, like Jason had stated. And I think a big thing that you can do is just small check-ins. So my therapist, when we were in quarantine, she kind of asked, like, do you want to talk about the climate that's going on? Like, you don't have to, but I did want to let you know that I'm here for you, and I realize what's going on. I'm here to support. So if you would like to talk about it, we can. But if not, we can move on. And I felt like that was super nice that she was mindful of that and had thought of me with everything going on. And we did talk about it briefly, but I kind of had said, like, I don't really want to dive too much into it because it is very overwhelming what's going on. But I do appreciate the fact that you reached out.
I really want to go ahead and wrap up this session. I want to thank the panelists, Taj and Tida from Spelman College, Nyla from Robert Morris, and Jason, who has been doing some great work as a clinical staff member and just doing clinical great mental health work. We also want to thank Black Mental Wellness for providing this space to be able to have this virtual conference. There is a last question, and I want to just touch on that really quickly about tips on how to increase one's motivation while at home. I would suggest that you take a look at your space and reorganize your space. Make sure that you are studying in a space with good light, because vitamin D is important. Make sure that you are like getting up and getting dressed for the day, good hygiene hygiene is important, taking walks, and just finding ways to commune with nature also. And you can do all these things while being safe. Motivation level, just giving into yourself. Sometimes you may feel exhausted, and that's okay. Take a nap, wake back up, eat a good meal. Nutritious meals are important. And then connecting with others, building your support system. Thank you so much for joining us today. This has been a phenomenal time. It's been great meeting you all virtually, and even working with this new system. And I just want to thank you, thank you, thank you. And we see your messages in the chat. There's some Spelman people in the chat. There are people that were saying great points, and that they noted that the affirmations work, that they deserve to be here. And so we know that it's important. This conversation is important. And so we hope that you all will continue these conversations in your homes, in your communities, but especially on your campus. Be safe, be well. Dr. Fluitt signing out. Bye, everyone.